Good afternoon. The legends of SARC Academy of Ophthalmology, Professor Natarajan, Ajit Babu Majhi, Lalit Verma, and other dignitaries present here. I welcome you on behalf of SARC Academy of Ophthalmology Bangladesh chapter, as because I am Vice President of SARC Academy of Ophthalmology. Today, I will briefly describe some of the parts of prevention of blindness in Bangladesh. You all know this is our flag. In all the time when I come to India, I always respect the help of Indian people during our liberation war in 1971. I salute all the people of India and also the people who has died during the liberation, the soldiers. With this, I start the eye care services in Bangladesh. You know, in our country there are different parts, increased demand of eye care. This is the objectives. These are the increased demand of eye care services, but particularly for cataract in the community. Everywhere you all know this is going on, and increased accessibility to quality eye care services, especially cataract, particularly for the poor, develop efficient human resource of service, providing eye care facilities, management of program efficiently and effectively. We have the practices by government sector and some private sectors like BNSB, National Eye Care, Vision 2020 National Advisory Committee, Vision 2020 District Committee and observation of World Sight Day, and orientation of training of healthcare providers from community clinic to specialized hospitals. And there are 6,000 populations community clinic are there. They are the first capture these patients and they refer it. And there is the regular dissemination of eye care messages through Health Education Bureau. We have the MOU with the ministers and coordination between a meeting with the health ministers. National eye care services are also going on, and there are some SIC's guideline, treatment protocol and examination protocol. Primary eye care manual for primary health care workers are there, guideline for OT and ward management. Yesterday I got the guideline of infection of All India Ophthalmology Society. So some of the guidelines like uveitis and some infection, and also OT and ward management of nurses and paramedics are there, and counseling in the eye care. Apart from Bangladesh Medical Research Council and National Institute of Ophthalmology, specialized hospitals in their different fellowship, masters and PhD in our country. There is the partnership with INGO, World Health Organization and National NGO, and BNCB reconstituted wider partnership of NGOs, and Vision 2020 Advisory Committee consisting of members from all walks of life are functioning well. Now the present infrastructure, medical colleges, there are 36 public and 64 private medical colleges, and postgraduate teaching hospital about 23, 7 divisions of specialized hospitals and 64 district hospitals. These are the secondary care, and also 92 upajilas where there is the primary care, and also we have 40,509 wards are there, and there are 13,000 community clinics. Elimination of avoidable blindness from Bangladesh by the year 2020. Our specific goal is the elimination of the backlog of cataract blindness from Bangladesh by the year 2030. And you know there are about 8 lakh backlog are there. And core interventions are prepare action plan for prevent patient screening program, develop plan for community mobilization and orientation of staffs on primary eye care, dissemination of the eye health messages, patient detection, referral to eye care facilities and follow-up. Then you all know all the causes of blindness in the same region. And in Southeast Asia, cataract, uncorrected refractive error, glaucoma, corneal opacity and ocular injury are much more. We all know about the global blindness scenario. I will skip up. And in our country, cataract is about 65%, refractive error is 19.7%, glaucoma 1.8%, posterior segment pathology 4.7%. There are the corneal opacity about 0.9%, and in our country vitamin A capsule is given in EPI schedule. So night blindness have been reduced in our country, and also corneal, conjunctival xerosis, corneal xerosis have been reduced, and childhood blindness through xerophthalmia previously was much more and it is less, and the congenital cataract, congenital glaucoma, optic atrophy and uncorrected refractive errors. The epidemiological, how we can prevent the blindness. Initial assessment, methods of intervention, primary eye care, secondary care, tertiary care. In this way we are making the national program for control of blindness. In Bangladesh, probably cataract is the highest causes of blindness, and we are making the mass eye camp services, about 400 to 500 in a same day we are operating. I think in your country also the eye camp are going on, and this is the only thing we are preventing the cataract blindness. And also general doctors trained in primary eye care and refraction worked in primary eye care center with nurses and organizers, and in this way we are performing the cataract eye camps and we are preventing the cataract blindness. The major features of MEC model is the district focus and comprehensive eye services. The major features of modular eye care services are modular approach and sustainability. I will skip up this as because you all know it. And to reduce the backlog of blindness through identification and treatment of blind, to develop eye care facility for every district, to develop human resource for eye care services, to improve quality of service delivery, and to secure participation of civil society and private sector. Strengthening service delivery, development of the human resource, promoting outreach activities and developing institutional capacity. I have already mentioned some of our national level and secondary and tertiary level, and we are performing national level through DGHS, ministry, and administrative division, and district hospital, ophthalmic surgeons and district mobile unit, and also involvement of the NGOs, eye camps, eye banks, civil works, training, commodity assistant, eye posters, video, radio in local languages, and monitoring and evaluation and collection of utilization of donated eyes. And we have also district blindness control society, and these are working like this to assess the magnitude and the spread of blindness in the district, to organize screening camps, to plan and organize training of community level workers, teachers, ophthalmic assistants, nurses involved in eye care services, because the manpower is much less. In the school, sight testing is also being performed by the teachers who have been trained up. We have another thing like India, in Aurobind, we have also started Model Vision Center, is anticipated by Vision 2020, and we have trained up the nurses. They are taking up the photograph of the retina, they are sending it, and in this way we are performing the retinopathy, diabetic retinopathy screening, and if the patients are needed of, they are being referred. This Vision 2020 program, the three essential elements: disease control, human resource development, and infrastructure development. In our country, primary eye care is also being involved. Current practices, orientation of primary healthcare workers in Upazila Health Complex, primary eye care going in integrated community clinics. Community clinics are referring the patients to the Upazila, and then they are going to, the patients are then, if necessary, are being treated in the secondary and tertiary care. Ophthalmic technician, ophthalmic nurses are also being trained up, and you know, in our country you have 22,000 members in AIOS. I have 1,200. The population is 160 million. We are needed of at least 1 per 1 lakh, at least 1,600 we are needed of but still we are lacking behind. When there will be 1600, the demand will be 2,000. So still we are lacking behind. We are very much, you are helpful to us. Many of our Bangladeshi people.
If you want, we will send 400 from here. It will.
Yeah. If necessary, we can take it. But still, we are becoming trained up from different institutes of India. So I am also grateful for that. The main problem is in our country is that in future, I hope the ophthalmologists will be much less. They are not coming up. Why, I don't know. Maybe due to NGOs. They are coming every year. The postgraduate are coming not more than 30 to 40. So the newcomer are not interested in ophthalmology in our country, though in your country they are very much interested. I have seen in Korea and Japan, many people are coming in ophthalmology. They are the number 1 or number 2 in position. But in our country, we are getting the disinterest of the people who are not coming. The patients who are being examined in the vision center are consulted with the ophthalmologist, and you know, by the name of our wife of father of the nation, there is one center, Sheikh Faziluddinesa Mujiba Hospital. There is the training institute also, and the nurses are being trained up from India. They are going there and they are becoming the TOT, trainer of the trainee. So they are working there. Through this, the vision centers in our country are now working very nice, closely with the community, and through community workers. We hope in future we will select the patients and we will be able to work together to prevent the blindness in our country. In addition to the vision center, one ophthalmic nurse acts as a coordinator to look after the non-clinical activities such as registration, maintenance, record, and outreach manager, outreach organizer, and field workers. With this, we are working together to prevent blindness in Bangladesh. With these few words, thank you very much for patient hearing.